Good afternoon, and hello, everyone. Welcome to today's event, Ask Me Anything, Stay Sharp, Microplanning for the Flu and COVID-19 Vaccines. This is actually the 6th of our series, so welcome if you're brand new. Thank you for joining us, and if you are somebody that's returned, thank you so much for joining us again. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my division colleague, Sarah Price, the Deputy Director of Public Health Integration. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been muted and will be muted for the duration of this event. The duration of this live event is approximately 30 minutes, including introductions and, of course, a live Q&A. Thank you so much for submitting questions in advance. And, of course, we will be taking your questions throughout today's event. Again, the duration of this live event is approximately 30 minutes. As I just mentioned, if you did submit questions in advance, thank you so much for that. We greatly appreciate it. But, of course, this is a live Q&A session for you guys. So the Q&A box is located in the lower right-hand side of your computer screen. It is open right now. You may need to expand the panel if it's not there already on your computer screen. Simply type in your question, select to all panelists, and hit send. Again, that Q&A box is open right now, so feel free to shoot your questions in at any time throughout the duration of this event. If there are questions that we cannot answer in the time allotted or we need additional resources, we will make an attempt after the event is completed. Friendly reminder, today's event is being recorded. All attendee lines have been muted and will be muted for the duration of this event. The Q&A box is currently open and ready for all of your questions for today's event. And again, if we cannot answer your questions in the time allotted or we need additional resources to answer those, we'll either put those in our FAQ document or actually reach out to you individually to get you those responses. At this moment, I'm going to turn things over to Sarah, who will be introducing today's speakers and give you a lay of the land. Sarah, the floor is yours.
Thank you so much, Liz. Welcome back, everybody. Thanks to those of you who are return guests, and welcome to new ones. We have found these webinar series really practical, really timely. We try to give you the most up-to-date information on these, and so we're excited about today. We're going to start today with Claire Hannan from the Association of Immunization Managers to kind of do some more level setting with us. She always brings the most timely updates from the field at large. And then we'll move over to our guests from Holyoke. They're with the pharmacy team at Holyoke Health Center to give us some of their practical experience in the field. But we'll start with Claire to give us just a quick update on how things are out there. Claire?
Thanks very much, Sarah. I know our time is precious and you all have a lot of questions, so I just wanted to cover a couple of things, kind of where we are and what's hot. So one thing I wanted to show was this COVID vaccine tracker. If you have not seen this, this is generating a lot of media questions, a lot of questions. I'm guessing that you're getting calls, people seeing this and saying, I want one of those doses, basically. So this is the CDC COVID tracker. It shows how many doses have been distributed, and that means how many have actually shipped out. And then it shows how many have been administered. And that shows actually how many that have been reported to CDC as administered. So it takes a good bit of time. The steps in between distribution and administration take a good bit of time. And I think you can see that there. So we get a lot of questions around why are states saying they need more doses, they're dying for doses, when it looks like there are so many doses out in the community. So many of those doses, a lot of those doses are, of course, already spoken for. They've already been shipped to administration sites. Many of them are in the long-term care facility program, or, they are in somewhere in that system of having been administered and haven't been reported yet. So I would just focus on, what you're doing, what you're hearing about vaccine. Again, the supply still going like this, level allocations every week. And as we add more populations, the demand goes up and the supply is staying level. So I think that's why you're seeing, this real desire for doses. I'm sure you're in a position where you want doses too. So I just wanted to go over the tracker that's on the CDC website. You can also look at, they took down the doses distributed to long-term care facilities, but they do have the doses administered in long-term care facilities. And so I think that's a key thing to see as well. Next slide. So the other thing I wanted to cover, of course, is, you know, what's happening with the Biden administration. So Biden has come in, and on his first day, he's spending a lot of time on vaccines. You know, I wonder why. So he's laid out a plan. There is something coming out today that has more detail to that plan. I wanted to just point out a few things with it. He's talking about opening up to 65 and over, encouraging all states to do that if they haven't already. Most already have. And then I want to focus on this creation of more vaccination sites. And apparently he's working on a plan to allow states to request FEMA to come in and run federal vaccination sites. So to set up clinics in states, in communities that need more administration sites. He's also talking about the role of community health centers with that. And one thing that you can look for, I don't know, we're still looking for more detail on it, but he's talking about using community health centers to potentially be some of these sites. And what we don't know is where the doses would come from. I mean, right now, really, the holdback to more vaccination is the doses, not necessarily the sites. But we're looking at where would he get these doses, and if we were to get, let's say, Johnson & Johnson coming into the field, get more doses there, you know, how would he use those? Would they potentially be allocated directly to some of these sites, such as community health centers? So I think that's something we really need to pay attention to. And so just to keep your eyes on that. A couple of other things. Johnson & Johnson should be filing for an emergency use authorization next week. We've heard January 28th. It would generally be about 2 weeks. It took 2 weeks for Pfizer and Moderna to be considered by FDA, but we haven't seen anything put on the calendar or anything like that as far as an FDA meeting. But potentially in several weeks, in the middle of February, we could have a third vaccine candidate coming in. And this is a one dose that's refrigerator stable. So it could really be a game changer. So those are the things I wanted to point out. And of course, as always, happy to answer questions and can't wait to hear from you guys that are out in the field.
Thank you so much, Claire. Always exciting to see what happens from week to week. So thank you for laying the land for us. Next slide. I'd like to introduce the team from Holyoke Health in Massachusetts. You can see their beautiful picture there, and you see them all masked up to present to us today as they're presenting together. So I just want to give them a few minutes to talk to us about what they've been doing with COVID-19 vaccine in their community health centers. So take it away, Holyoke team.
Thank you, Sarah. So my name is Alyssa. I'm one of the clinical pharmacists at Holyoke. I'm joined off camera by our Chief Pharmacy Officer, Lori, our clinical and informatics pharmacist, Gerald, and I also have Amy, who I'll swap out with in a moment so she can answer some questions. We're all listed in the picture. We're also joined by Rosie Romero, who's our Assistant Clinical Director, and a member from Medical who's been helping us with our vaccination efforts. In addition to us here in the room and on camera, our vaccine clinics have been majority pharmacist-led. With Rosie's help from the medical department, we had the help of some of our other clinical pharmacists as well as our pharmacy residents to get vaccination going at the health center. So we received our first dose shipment on the 22nd of December, 400 doses, and we started our clinics on the 23rd. Our providers, especially some that were in our influenza-like illness or COVID-facing clinics, were very anxious to get going with their vaccination. So within 24 hours, we had our first clinic up and running. It took us about 3 weeks to move through the 400 doses that we were given, first doses. First, we gave them to our employees, and then we moved to local emergency response personnel. We did the Holyoke Police Department. And then we were helping out some of the local public schools, their nurses who were part of the first phase, as well as some home health professionals that were indicated in Massachusetts, but weren't necessarily hooked up with a site to go and get vaccinations. So that's where our first 400 doses went. And as of this week, we have the 400 second doses now, and we started giving out second doses to our employees. So all in all, at this time, we've given out about 500 doses here in the health center. I'm going to move to the next slide, please. I know that a lot of the questions that people were asking have to do with this, which is our screening questionnaire that we're using in the health center to kind of decide who's indicated for vaccination or what other precautions we might need to take. I'm actually going to switch with Amy so that she can go over some of the questions.
So our screening questionnaire is based off of the CDC intake form that's available on cdc.gov, but we also added a couple of our own questions. This screening questionnaire helps us determine kind of some patient-specific counseling. So basically, the answers to those questions, if they answer yes for any of these, they'll get sorted into 3 different categories. Some patients might need some additional counseling or additional monitoring. Some patients might need to be referred to a clinician just to make sure that their provider okayed them getting the vaccine at this time, or some patients might need to have their vaccination delayed depending on their response. And so it just helps us kind of triage our patients and be able to take care of them the best that we can. So I think that's it for our presentation. We can open it up for questions.
Awesome. Thank you so much, Holyoke team, and to Claire as well. I want to remind all of our attendees, please feel free to go ahead into the Q&A box and start putting in some questions. We had some ahead of time that we will start with, but please feel free to go ahead. First of all, I think, there's questions out there just about the storage and handling of a vaccine. One of the questions that came in, it sounds like you got 400, which is probably you have the ability to store that. But one of the questions that came in is it possible or if you were getting a stock more than you think you could store at one time, have you talked about what you might do, like contracting with another laboratory or contracting with some other entity for storage while you're kind of moving through those doses? So we'll start with the Holyoke team as to whether you've heard of that. Claire, obviously, if you've heard of any of these happenings, we'll go to you next.
So I'll turn that over to Rosie. If Rosie, you can unmute.
Hi. So we have on the medical units, we have freezers in pretty much every unit. And the boxes for Moderna are not that big, so we can fit quite a big amount in them. So we hadn't really thought about having to use even our own pharmacy for storage. So we can just store on every freezer that we have on every unit. And my pediatric freezer happens to be one of the largest ones, so I can hold a good amount of doses in there. And I also have refrigerators on every unit. So what we usually do is, when we're going to have a clinic the next day, I do take out what I need for doses for the next day and put it in the fridge so it thaws out. And I usually just move it from the freezer to the fridge. And again, I have enough space for that right now. So I don't think we will need to contract, but I mean, if other places aren't big and don't have enough capacity, that's something that you can think of.
Excellent. Thanks for that advice. Claire, have you any advice or anything to add to that?
So I would just say that, it is a piece of the enrollment form to have your storage and handling plans or equipment, laid out. So if you're going to make a change to that, if you're planning on contracting for storage and handling, you need to make sure that you update that in your enrollment form and that it is, an approved, storage facility or storage equipment that can be used. So that's what I would say to make sure you do that.
Yeah, great point, Claire. That's part of that enrollment process. So yeah, great. Sorry, I unmuted myself. I don't know why. Next question, actually, and this is something that has been kind of a hot topic, at least around NAC this week, is about utilizing other entities other than nurses, providers, and pharmacists to vaccinate. The workforce is slim some places. And so one of the questions that just came in, as well as another question that came in previously, is what are some of the processes that are in place to either utilize other healthcare providers? The question that just came in is specifically about dentists, but also is there any move to looking towards getting volunteers from the community, whether that be for screening purposes or also to actually give the vaccine? So Holyoke, do you answer that one first, please?
So I know I'm a faculty member at a pharmacy school, so I know that we've been making a push to make sure all of our students get their immunization certificates early on in the curriculum, earlier than we normally would, so that they can help with vaccination efforts. I believe that when the H1N1 epidemic happened, they did allow dental providers to help immunize. I'm not sure if Claire or Sarah can speak more on that, but I do think that's something that, you know, people are looking for. We also talked about using volunteers. We have community health workers to help us with the screening intake forms, and so kind of just using the community that we have to have that available.
Excellent, thank you. Claire, anything to add?
Yeah, so we've gotten a number of questions about this too, and we asked our members. They reported to us that, so some states do have orders in place, executive orders allowing pharmacy techs, veterinarians, dentists to be providers, and it varies by state. And also, the federal government has provided protection in the PrEP Act to certain groups, and they just added the National Guard to that. I think there may be an effort to add veterinarians or others to that. We're seeing that many states are reaching out to pharmacy schools, to medical schools, to nursing schools to tap into those students and ask them to help. And then there are some states that have an ability to recruit volunteers in their registration sites. So as we get more information about that, we'll share. But I think, I think this is, a big issue, trying to find volunteers and tapping into ways to collect and use them.
Great, thank you. Well, one of our, we just got a comment that came in that said we utilize medical assistants, nursing students, and dentists with appropriate vaccine training and handling first. So yeah, it sounds like this is something that a lot of health centers are looking at currently, and we'll be keeping our finger on the pulse of that. I want to move a little bit. I'd had a pre-discussion with Holyoke a week or so ago about exactly when they got those doses and kind of their approach to getting those. And one of the things that struck me, and I think we actually saw it in the picture, was how you really created a positive environment, especially to your staff, about getting the vaccine. Can you talk a little bit about, I know you did like a webinar, you have a social media like celebratory station. Can you talk to us a little bit about that?
So we held two different all staff meetings virtually with all the staff at our employees with our employees to really address any vaccine hesitancies and do just an open Q&A forum for them to be able to ask and address any concerns that they may have. And then we recorded a little video that we played before each person got their vaccine that went over some important counseling points. But what I thought was really special is we had a little clip of our Chief Medical Officer, Dr. Esparza, who really spoke more from an emotional standpoint of really how lucky we are to be able to be one of the first ones receiving this vaccine, how needed this vaccine is, and it really started that whole positive environment going. We had our marketing department be able to put up like one of those selfie walls. We got balloons, and we really encouraged all of our people who got immunized to take pictures and share it on social media, because we have seen the power of, that word to word of, I know somebody who got it, and kind of helping with that vaccine hesitancy. And so that's been really powerful for our employees.
Excellent. Thank you so much. Another question, speaking on hesitancy, we try to cover at least one kind of mythbuster or hesitancy issue every call, but it's on pregnant or breastfeeding women. There's a lot of questions out there about whether it is safe, whether it was tested enough or whatnot. So Claire, I'm actually going to ask you first, just come from kind of a broader perspective of what you're hearing out there about it, and then Holyoke specifically, if you can talk about your specific approach to pregnant or breastfeeding women.
Yeah, so pregnant and breastfeeding women, it's really important to offer them the vaccine, and you can use the ACOG statement. The Association of OBGYNs has a very strong statement. Pregnant and breastfeeding individuals, really need to be offered the vaccine and given the opportunity to vaccinate, although it wasn't specifically tested on pregnant women. They did in the clinical trials, I keep track of those who got pregnant. They are following them in the trial. There haven't been any concerns raised. And as we move forward with vSafe and with the vaccine safety monitoring, all of those who are getting vaccinated now will be tracked and monitored. And, so far there are no safety flags for pregnant or breastfeeding women. So the answer is, yes, you should offer them the vaccine.
Holyoke team, what's some experience that you've had with that? Or do you take the same approach?
Yeah, so I actually am a breastfeeding mom. I have a 7-month-old at home, and I chose to get the vaccine, which also made sure that I did a ton of research ahead of time. And so for breastfeeding women, I think we all agree with Claire, like that definitely should be advocated for, and you can encourage your lactating patients to go ahead and feel comfortable getting that vaccine, even though we don't necessarily have the data right now. If anything, the vaccine is not thought to be able to get into the milk compartment. But if it did, the baby would most likely just digest it like any other protein, right? That's why vaccines aren't given, or this vaccine isn't given orally. It has to be injected. So it's not thought to be able to pass them to the baby. And you might be able to pass some healthy antibodies to help protect your infant. Again, that's not based on any clinical data that we have right now, but that's a theoretical kind of thoughts of what the medical community thinks. We have vaccinated 2 pregnant patients so far. We explain the same thing that Claire just explained, that we don't have that data. It's ongoing, but they are collecting it, and everything that we have so far says that it is good to give. The American College of Obstetricians and Gynecologists, ACOG, does recommend that pregnant women receive the vaccine. So does the CDC. And I spoke with one of the midwives who was saying that if you are in your first trimester, you are able to wait, into the second or third trimester, it might be good, not because he thought that the vaccine would negatively affect the pregnancy, but just because the risk of miscarriages is high. He doesn't want his patients having that feeling of guilt or second guessing that everyone kind of has when you experience a pregnancy loss. So I have heard some information about maybe encouraging patients, if they can, to wait. But if you're at high risk, there's really no need to wait for that vaccine. So it kind of should be up to the patient and their provider to make that risk versus benefit judgment when deciding to vaccinate a pregnant patient.
Great, excellent. We have time for one more question. And this was submitted beforehand, but it asks, how long does an individual have to wait if they've already had COVID to get the vaccine? We know there's a lot of resources out there, but again, it's Ask Me Anything, so we're throwing it out there. So Rosie, are you able to answer that question?
Yes. So right now we have been vaccinating even some of our staff that have had COVID in the virus in the past. We do not vaccinate anyone that has the active virus or they're on quarantine protocols. We do ask that they wait and reach out to us once they're back in the clinic. But right now there is no contraindication for you to have the COVID vaccine if you have had the virus. We do warn staff, though, that if they have had the virus, their symptoms or their, building immunity could be a little bit more intense than someone who has not had the virus.
Great. Thank you, Rosie. Anything to add, the rest of your team or Claire?
No, I think Rosie covered it.
Great.
Yeah.
Great. That's why y'all are a team. Claire says thumbs up. Perfect. Perfect. And actually, we have about 1 more minute and no more questions at the moment. Oh, sorry. We do have 1 more question. It's a theoretical question, but we'll see what you all say. Should patients take the flu shot or the COVID-19 shot first if they haven't gotten the flu shot yet? Ooh, that's a good one. That's a good one. Because, we're pushing both. Any thoughts there? I don't think there's a wrong answer here, but just, I guess, an opinion.
Yeah, I guess just my personal opinion is since the COVID one is so hard to find right now, I would jump on that one. But yeah, then definitely go get flu. The flu vaccine is going to be available. So yeah, that'd be my advice.
Excellent. It looks like the Holyoke team has conferred with each other.
Yep. So yeah, you can't give them within 14 days of each other. Our consensus was definitely to encourage the COVID first, just especially because at this point we feel that you're probably more likely to come in contact with COVID than you are the flu. We were just talking about, how many Tamiflu prescriptions we've even seen this year, and we're hardly seeing any. I think the flu has been kind of tampered down now that COVID's kind of more focused. So just a risk versus benefit, we would say to maybe try to get COVID first if you're able to.
Great. Thank you. That was a great question. Thank you to the person who submitted that. That's all the time we have for today. I just want to thank, again, the Holyoke team and Claire as well. Thank you so much for being on today and taking questions as they fly in. If there's any additional questions after this webinar that you would like to send to either Claire or the Holyoke team, you can email me directly at sprice@nac.org and achc.org. I'm happy to send those on over. Just as a reminder, we have actually 1 more webinar that will be next Friday. We will have a different guest. Unfortunately, Claire cannot join us this time. But we'll get her back on something eventually, so you'll see her face again, I'm sure. But if you haven't registered for it, you can go ahead and use your phone right now and scan that QR code on the screen and register for that. And then we'll be kind of looking around at NAC to seeing some other ways that we can share this information. But next week will be our last webinar. Next slide, Liz. I wanted to remind folks as well that we do have a COVID-19 related link on our website. This is one of our newest tools that was developed actually in collaboration with a lot of you out there, and it really walks through every step of microplanning for COVID-19 vaccine delivery. So if you just need kind of a one-stop shop to look at and to make sure that you've crossed all your T's and dotted all your I's when it comes to microplanning, this is just a really simple resource. It's great to also give to board members, to non-clinical people who may not understand the whole process, but that is available for download on our website, and we thank you for all of you who contributed to that. And then finally, just thank you to you. We are out of time today, but thank you again. We love to hear all that is going on out in the field, so please continue to share your stories, share with one another. Again, thank you to the Holyoke team for talking all about the great successes that you've had and just the innovations and the creativity you've had. Thank you, Claire, for keeping your eye on the ball and keeping us moving forward with all the updates you had. And
yeah,
all the participants.
You're very welcome.
Thank you.
Thanks, everyone.
With that, we'll let you go. Thank you all.